Joining us now is Dr. Joseph Varone, Chief of Staff at United Memorial Medical Center in Houston. Doctor, thank you so much for joining us again this week. We appreciate it. Just kind of give us an update on what you're seeing in your hospital.
What we've been seeing is an exponential increase in the number of cases. There is no day that I don't admit a series of patients with severe coronavirus disease.
Absolutely. I think we hit over 3,500 deaths yesterday. What is your message to the public as we go into this time of the year that everybody, the CDC, the FDA, everybody's so worried about?
I mean, just think about it. Just yesterday we hit a record number of 210,000 new cases, more than 3,000 deaths. Normally, people die every day from cardiac conditions, about 500 deaths per day. This is an illness that now is killing 6 times more than any cardiac death. This is a scary situation. People need to be careful. People need to continue to do what we've been telling them to do. Wear your mask, keep your social distance, wash your hands, don't go to large crowds.
Yeah. Well, earlier this week, we talked about the UK approved the Pfizer vaccine. They're going to start using it here very soon. We're still waiting for our FDA to approve the same vaccine. And I think it's frustrating a lot of people. But yesterday, you held a news conference. You talked about a drug called ivermectin to help treat COVID-19. I think I pronounced that right. I guess it normally treats parasites. What can you tell us about this?
That is correct. There is compelling data that ivermectin can actually be used to treat the illness as well as to prevent the illness. And what we're trying to do, actually, we're having the press conference today, we're trying to tell people to understand that this is a medication that has been used in Brazil, Bangladesh, India, Egypt. People can take it prophylactically once a month, and they seem not to get the illness. We're not telling the American people, go ahead and buy ivermectin. What we're telling the health officials is to look into the data. We're telling the NIH, look into the data, and then if you think that the data that's out there is worth what it's saying, go ahead and establish policy.
Yeah. We talked about, the death rate of this virus, as we've gotten better at treating it and better at handling it, has gone down. The amount of people that die after they get it is going down. How is it that the caseload and the death rate has exploded so much knowing that? Is it just we're just getting... Go ahead.
People are getting careless. People are getting the COVID fatigue syndrome, They don't care about COVID anymore. They are going out, they are doing their lives, they are forgetting these basic things, and we're testing more people. So obviously we're going to be seeing more cases.
Yeah, it's the lockdown fatigue. You're right. People, and understandably, we've been locked up for so long. It's frustration with that. Doctor, thank you so much for your time. We do appreciate it. I know how busy you are. Thank you, sir.
Thanks.
Okay, coming up next, talking with Kyle Rittenhouse's mom after the break. The teenager